that. We are recording this program and it will be available on the Public Health Museum website after it's over. And I'm Al DiMaria. I'm the president of the Public Health Museum. And tonight our program is co-sponsored by the Massachusetts School Nurses Association organization, and the School Health Services at the Massachusetts Department of Public Health. And I want to thank them not only for helping getting this program together, but also for all they do for public health and for our school children and for our communities. And that's sort of the topic tonight. We're going to be starting with a discussion with Dorothy Keeney, who is the Boston school nurse historian and author of The Untold Story of Annie McKay and the Boston School Nurses, 1905 to 1988. And it's a fascinating book, extremely well documented, well researched, and has an enormous amount of information about the history of school nursing. And because our topic is yesterday, today, and tomorrow, we thought it was appropriate to start with sort of a historical underpinning. So, Dorothy, thank you for coming. Thank you for writing the book. I enjoyed it. And let's start with, where did school nursing start? And who is this Annie McKay?
Well, thank you for having me. Well, a group of us from the Massachusetts School Nurse Organization attended the 100th anniversary of school nursing founded by Lillian Wald at the Henry Street settlements. And I was interested in going because I had been a public health nurse in Manhattan for the Department of Health, and we covered the schools. So the Henry Street settlements are in New York City on the Lower East Side. And Lillian Wald started the Henry Street settlements in 1893, and they gave nursing care to the poor. At the same time, schools had outbreaks related to poor sanitation and overcrowding in the tenements where these children lived. And they had diseases like scabies and ringworm, impetigo, conjunctivitis, and head lice. But the children lived in areas where there was poor sanitation and overcrowding in the tenements. They also had contagious diseases as diphtheria, scarlet fever, pertussis, mumps, varicella, and measles, and this would sweep through the crowded tenements and the classrooms. In an effort to stop this, the Department of Health hired 150 doctors in 1897, and the doctors were to inspect the children in the schools, and they would do this for 1 hour each day. And the students who had contagious diseases were to be sent home, and they were to return to school when their condition improved. But this had no effect. The reasons were that a few, if any, treatments or instructions were given, and the children continued to play with their classmates after school and spread their ailments in the neighborhood instead of at the school. Plus, some teachers resisted the examinations. So I found this interesting that the chairman of the Board of Education and the city's health commissioner sought advice from the Henry Street settlements for improving the system of school medical inspection. So Lillian Wald suggested using a nurse to treat the children as possible in school and make home visits to the home to ensure parental cooperation with the treatment plan and check other members of the household for signs of contagion.
So Lillian Wald was really just like in initiating the visiting nurse, the public health nurse, she created a school nurse too.
Yes, yes. Yeah, so she offered to supply a nurse for the Henry Street settlements for 1 month. And if the service proved valuable to the city, she made them promise that the city would create a permanent position for a school nurse to be paid out of public funds. So this started in October 1902. She was given 3 public schools and a parochial schools. So Lena Rogers was a Canadian, and she was given this position. After 1 month, they were so pleased with her work as a supplement to the medical inspectors that they hired another 12 nurses. In September 1902, under the old medical inspection system, 10,567 students were excluded from school for health reasons. And this contrasts sharply with September 1903, a year later, the number of children excluded from school for health reasons dropped 90% to 1,101. So by 1903, they appropriated $30,000 for 27 nurses at a salary of $900 each year for 125 public schools and 4 parochial schools, with Lena Rogers as the supervisor. And they treated, the school nurses treated these diseases: pediculosis, conjunctivitis, ringworm, impetigo, scalp infections, and scabies. So they treated these diseases and followed up with the children. Lena Rogers said that she preferred working for the Board of Education as opposed to the Board of Health as a school nurse. And the reasons were that there was closer contact with school personnel, and it was easier to work with one bureaucracy instead of 2. So
Dorothy, so they went from like having four schools to 125 schools within a very short period of time. So it was very clear that this was working.
yeah, well, they after 1 month, they made their decision.
Yeah. So let's get to Annie McKay in Boston. How did she wind up? How did Boston wind up doing this? Was it because they saw what happened in New York?
Well, Lena Rogers did come up to Boston at least one time, and she spoke to several organizations, telling them about the success that New York City had with taking care of the children. And I don't know when she said that she liked working for the Board of Education more than for the Department of Health. So I don't know what effect that had on Boston, because Boston started off with the Board of Education. So how I got started finding out who Annie McKay was. Well, a group of us went as I said, a group of us went down to the celebration that the Henry Street settlements had for the 100th anniversary in 2002. And so we got to thinking, well, who was the first school nurse in Boston? And Marcia Buckminster, who was the president of MSNO at that time, said, well, it must have been in Boston. So she asked me if I would follow up on that, and I did. So the first thing I did was go to the superintendent's office. I thought they might keep a file, but they don't. But the secretary brought out a book from the Boston School Committee minutes announcing their plan to place a nurse in the school, specifically by the Instructive District Nursing Association and the Mothers and Fathers Club. And the secretary also left me a note wishing me luck on my research, and I've always kept the note. The problem was I didn't know what the Instructive District Nursing Association was, and neither did the reference librarians at the Boston Public Library. So finally I decided it must be the visiting nurses, and I called them, and immediately they said that they had a book for me that would give me that information. I went to their office in Brighton at the time, and their annual report listed who the first school nurse was and her credentials. And that listed her school of nursing. So I wrote to the hospital, and they sent me a copy of her application from 1891.
And this is up in Canada.
Yes, yeah, right. So on her application, they listed her religion, or she listed her religion as Presbyterian. So I thought there must still be a church in her hometown. So I wrote to the minister, and he said, you know, he got back to me immediately, and he said there was still a McKay family in the area, and he put me in touch with a cousin, Roberta Mitchell. So she sent me a short history of the family and a picture. And the picture that she sent is the picture on the book. Yeah.
Remind people, I don't know.
Yeah.
Plus,
And
I can't see that. Anyway,
the Massachusetts School Nurse Organization placed a plaque on the building where she lived at 1521 Washington Street in the South.
I remember that.
Yes, you were there. And
So, you know, there's so much I want to ask you about. I don't want to run out of time. So just tell us, like, what Annie McKay's day was like. What did she do?
let's see. Well, let me see. Well, she was hired by the Instructive District Nursing Association in 1891, and then the doctors found that she did very good work. So IDNA said that they selected her because she was one of their most experienced nurses, and she was placed in the South End at the Josiah Quincy School, the Andrews, and the Way Street School. So after 8 weeks on the job, she had 215 encounters with students in school. She made 576 home visits. She checked health of the new entrers and returning students. She dressed blisters, sores, and burns. She removed splinters. She checked their vision and hearing. And the most common cases that she found was defective vision, adenoids, and tonsils.
So these early school nurses were really addressing not only the medical issues these kids had, but the social determinants of health as well. So they would do home visits. They would take the kids to appointments.
Yes. Yeah, they took the children to appointments. Well, Florence Nightingale said that the visiting nurse required a higher calling, and she had to be independent. She was on her own, and she didn't have anyone else to rely on. So she had to be confident in the decisions that she made, because she couldn't call for a doctor or nurse in the next room. So in her talks, Annie McKay said she focused on the welfare of children. And she said that the people in the poorer communities sometimes neglected their children. And whether this was due to ignorance and superstition or just postponing their duties, this affected the children's welfare. And the people in the poorer community, she said, had a lot of superstitions. For instance, the subways were new then, and Boston was the first city in the US to develop a subway system. But some people were afraid to walk down the stairs because they felt they might meet the devil. They were afraid of taking frequent baths because it led to tuberculosis. And they had a fear of fresh air and a general lack of knowledge about what to feed their children. And an example of that is that there was a child in school, a boy, who complained of stomach aches in school, and he looked anemic and he was pale. So Annie McKay made a home visit, and she found out that the child didn't eat any food other than drink tea. So Annie McKay had to impress upon the mother the importance of proper nutrition and eating quality food.
So she was really an instructive nurse.
Yes, yeah. They went to the homes,
Yeah.
and they taught the parents how to follow a treatment plan, and also how to prevent the spread of contagion within their own home.
Would it always also be that the parents often had to work and couldn't be at home with the children, or there are other factors? A parent might have been sick or injured, or so the nurses also had to deal with those kinds of issues, right?
Yeah, they had to deal with all those issues. And the immigrant parents came from humble beginnings, and as always, they came to the US to have a better life. Generally, they were lucky, the parents, if they had a 6th grade education. And 2 out of 10 adults at that time couldn't read or write. And there were no classes in the schools on diet, nutrition, or hygiene. And I visited the old Quincy school, and I feel that Annie McKay must have taken those children out on the roof for some fresh air, those anemic children.
Fresh air and sunshine.
Yes, fresh air and sunshine.
So, you see, in reading your book, I have this image of these school nurses, and there were more and more as time went on, and that they did a lot of different things, made sure the kids got their eye exams in their classes. Some of the things that still go on, but in a very hands-on way, as you point out, going to the home and instructing the parents and taking the kids for these appointments. And the impact was pretty well established. The absenteeism went down, and
Oh yes, the absenteeism went down, but the Boston School Committee wanted more proof. So they appointed a commission of 5 doctors to go and visit the schools, and the doctors found that a lot of the children needed a lot of medical supervision, but that certainly nurses supplementing the work of physicians would help the children in the school. And they advised the Boston School Committee to hire their own nurses. But the so in September 1907, the Boston School Committee hired 34 nurses and a supervisor. But the superintendent liked the school nurses and wanted them, to join the Department of Education, but none of them would. I don't know why that was never explained, but the Board of Education, the Boston School Committee required them to take an exam. I don't know, maybe that was a reason. I don't know.
So there was always this there was sort of a tension between the Board of Health, Board of Education, School Committee. I got the impression that there was a big struggle to professionalize the school nurse as a distinct profession within nursing. Is that accurate to say over the years?
Well, they let me see. They wanted respect and recognition as an equal professional, but I think people forget that early on the school teachers hired by the Boston Public Schools also had only 2 years post-high school education. And the school nurses wanted pay equity on the pay scale of the elementary school teachers. California had equal pay for equal work in 1870. That was just after the Civil War. And New York City acquired that in 1911. I can give you some examples of their salaries. The school janitors received their salary in 1907 was $1,620. The elementary school teachers received $972, and the school nurse received $648. And prior to 1948, there was a difference between the salaries of men and women doing the same job. But in 1948, the elementary teachers and the middle school teachers received the same starting salary, and male and female middle school teachers received the same salary. In 1954, there was a new law that women could marry and teach, whereas before they could not. They could not work after they married. And it wasn't until 1961 that school nurses in Boston and the teachers received the same starting salary.
It's a long time.
Yes.
And when was the Massachusetts School Nurse Organization? When did that start?
The Massachusetts School Nurse Organization started in 1970, and Martha Rich was the first president. So it's over 50 years old. And at first, the Massachusetts School Nurse Organization, the Massachusetts Nurses Association wanted to represent them, telling them that they would help them to obtain increases in their salaries. But by and by, the MNA said at one meeting that get a real job. So they decided to form an organization on their own.
And we're going to hear more about that. We're going to keep Dorothy, and we're going to bring in the panel now, and have a discussion about more of the history of school nursing, as well as where we are today and where we may be going. And I'd like to start by just going around and having you say what your role, how you got into school nursing and what your role was in or is in school nursing. And Dorothy, why don't you start, because we hadn't heard that. How did you get into school nursing?
How did I get into school nursing? Let's see. Well, as I said, I was a public health nurse in New York City. And I always liked public health, and school nursing does have a lot of public health aspects to it. I just one day I went down to the Boston School Committee, and I went up to the Department of Health there, where they hired the nurses, and I gave them my name. And they said, yes, we definitely need nurses. And they called me the next day and I declined. And the following day again, they called me up and they said, oh, it's only going to be for a few days. And I was there for 20 years.
Sounds like a familiar story. Let's go. I'm just going to go across my screen. So Marie DeSisto, Marie, you're next.
Hi, I'm Marie DeSisto. I have been a nurse for many years. I went to Northeastern for my undergrad program, get my BSN, and I lived in Boston. I grew up in Boston. I lived in the projects out in Hyde Park and saw a lot of interesting things in Boston. I always loved working with children, always wanted to be with children. And I had worked though in critical care and PCUs and that kind of thing. And my kid's school nurse asked me to come in, and I was living in Connecticut at the time, and to volunteer as a school nurse because she needed to go out for a conference. And I went in and I did work there for a day, and she said, did you like it? And I said, I loved it. I would love to come back, but I will never come as a volunteer again. This is work. This is hard work. So I just started subbing, and eventually I started working in Framingham, and then became the director of nurses in Waltham for 15 years. And I'm also served as past president of MSNO and NASN director for Massachusetts to the national organization. And what else can I tell you? I just love school nursing. I am now retired, but I think it's one of the best forms of nursing because you have long-term relationships with children and families and educators, and you can really make a huge impact.
Thank you. Sharon Harrison.
Good evening. Thank you for inviting me. My name is Sharon Harrison, and I am with Boston Public Schools. I've been a school nurse with Boston Public Schools for probably almost 30 years now. But I've been in a special needs school for the last 27 years. And it's the William E. Carter School. And serving children who are medically fragile and cognitively challenged. I've loved every aspect of nursing, and it's interesting to see how life comes full circle. I started off in as a new graduate in Chicago in oncology floor, and did bone marrow transplant. It was a time of when I was graduated where AIDS was the concern, and there was a nursing shortage. And then now to go, toward the end of my career and go through the pandemic and need those same skills was just really amazing to me. So very rich career. I love nursing. I advocate for the future of it.
Thank you. Avery Hines.
Hi, everyone. I'm Avery Hines. I'm the current Director of Health Services in Medford. I started in school nursing. I was previously a private duty pediatric nurse for medically fragile kids, and I started in the school subbing for a maternity leave of someone that I can actually see is an attendee tonight. So thank you, Jen, for that opportunity, because that is where I found my passion. And I started in school nursing first at a parochial school. And then I came to Medford and I was 1 year at an elementary school and then a middle school nurse. And now I found myself as the director. To say I found my passion in school nursing very quickly is an understatement. I think some people don't understand the richness of school nursing and the importance. And I just feel very fortunate to have found myself in this position so early, because I think it's an honor to be able to help students and families this early in my career, and to be able to continue that for years to come.
Thank you. Carolyn Rains.
Yes. Hi, good evening, everybody. So I, like Marie, also am a graduate of Northeastern University, and I am currently the Director of School Health Services for the Plymouth Public Schools. And prior to that, I've been on board in Plymouth for about 7 years. Prior to that, I was a supervisor in a school district on the Cape, in a public school district as well. And then also worked as a school nurse for 12 years in the South Shore community. So at the high school level. So I think I would say I became a school nurse. I got into school nursing mainly by default. I had been an obstetrical nurse for about 15 years and had subbed a little bit and just really, really liked it. And I really liked the adolescent population. So I took advantage of a position that opened up, and could not really realize the level of autonomy that a nurse needs to be working in a school. That I started in 1999 at my high school. I think the complexities involved, and certainly, we see so much. I mean, I think one of the big things that has changed, obviously, is technology has really progressed on so many levels with caring for children, as well as the technologies that nurses are expected to be proficient in. And I think so much of it is great. Social media has certainly been able to elevate school nursing to where it should be. I am also a past president of the Mass School Nurse Organization. Thinking probably almost 45 years after MSNO began, I became president. I was very fortunate to have some great mentors and role models, including Marie. And we got involved in some great legislative advocacy. And I feel like we were able over the years to have an impact and make a difference in supporting the lives of, health and safety of children across the Commonwealth. So thank you for having me.
Thank you. Meg Birch.
Hi there. Thank you for having me this evening. I came to nursing after a career in public health, working as a epidemiologist doing research. And then I went back to school and got my nursing degree. Initially worked in long-term care, and the nurse in the school where my kids went had asked me while I was a nursing student numerous times if I did I think I might like to be a school nurse. And once I was out and working, I started doing per diem nursing, and eventually took her position when she retired at Conway Grammar School. And I was there for about 8 years. Started as a district nurse in the school district that Conway is part of, Frontier Regional, after about 3 years, and then became a full-time nurse, district nurse at the very beginning of the pandemic. And then now, since last February, I have been the regional school nurse consultant for the Western region for the two, the Franklin County and Berkshire County. And as others have said, when I first started school nursing, I thought, oh my gosh, this is so much fun. And it does combine in a nice way, in my mind, public health and community health with school health and pediatric health. So it's a little bit of all together.
Well, I think it's clear now to everybody that you're all very passionate about what you do. And what I'd like to do next is just talk a little bit about, I looked at in the 1990s, there were a lot of things that happened related to school nursing in terms of enhanced school health services, comprehensive school health. School nursing was becoming more of a nursing specialty. And there was certification came into effect, and there was a lot of money from the tobacco taxes and the settlement funds. So a lot changed in the 90s, but you all have different experiences over different periods of time. And you've also taught me that school nursing structure is different in different communities. So, and we already heard about school nurses working for the Department of Education versus school nurses working for the health department, and how that works. So could each of you sort of give us a sense of how school nursing evolved during your experience, and what the big challenges are? But leave out the pandemic, because we want to get to that separately. And who wants to start?
I can start.
Right.
Hi. So just to go back a little bit over the 1990s, what was going on, of course, you mentioned briefly, was school nurses really worked as a team to be included in ed reform and got our Department of Education school nurse certification. And what that helped to do was standardize school nursing and standardize the qualification for who could be a school nurse. This was very controversial at the time and required a lot of advocacy, but there were actually, I learned when I taught at Cambridge College, there were people who were calling themselves nurses that weren't registered nurses or LPNs, but were working as nurses. And so that helped to eliminate that. Another thing that happened in the 90s was that in the early 2000s was that we really worked as a team with a group of partners to change some of the laws. For instance, Mass General Laws, Chapter 71, Section 41, listed who was a professional in a school, and it was teachers, librarians, social workers, blah, 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 blah. But school nurses were not on the list. And using that rationale, that prevented many school nurses from being recognized as professionals. We knew we were professional nurses. We had bachelor's degrees. We had experience in many settings, but educators said, but you're not on the list, so you're not a professional. So we really worked hard with our legislative partners to get that law changed, and that was very difficult. And as I mentioned, we developed strategic partnerships. So that became critical because prior to that, school nurses were always professional, were always working hard, were gathering data in their own communities, but it wasn't coming together. And so MSNO really worked hard with Ann Sheets from the Department of Public Health, who was really a godsend for all school nurses and all school children and should really be recognized. But we also worked with UMass. At the time, the American Cancer Society, oddly enough, really came forward. And they had a doctor, I think his name was Dr. Cody, who was really a strong advocate for school nurses. The MNA we worked with at that time. And we even had a nurse come to us from Colorado. Her name was Judy Igo, and she was a nurse leader, one of the first nurse practitioners. And she came to Massachusetts and helped us to become more of a team and to recognize how we needed to work together to advocate for school health and for school children, not so much for school nursing, but to improve the health of children. And then the final thing I'll mention, you mentioned the grants, which we got the Essential School Health Services grants, which gave us some money to come together. But at that time, we really worked on computerization. Computers were becoming common. And we actually had these things called DOS programs, and we were writing programs ourselves. And we started to gather data. And we were starting to come to the idea that we needed to have shared data points and standardize those data points. So we were all collecting the same data in the same way, getting computers, getting software. And I think the nurse leaders in my time, my tenure as a school nurse, we really felt that that was the data, and the computerization was what really has helped us to move forward in a great deal, and to help children, and to find a way to recognize some of the problems in schools and help the kids.
You know, I would support a statue of Ann Sheets at the State House. I think
Yes,
she's earned that.
yes, in Nurses Hall, that would be great.
Carolyn, do you want to say something?
Sure. I obviously re-echoing Marie's praise for Ann Sheets. I think she's been a role model and a mentor for all of us through the years, and having so much to do with providing, getting legislative support and with the Department of Public Health, providing these grants. Unfortunately, there isn't a lot of equity across the state. Not every school district is able to participate in what was the Essential School Health Service Grant, now the Comprehensive School Health Service Grant, that is very much focused around equity, which is great. Initially, I think the biggest piece with the Essential School Health Service Grant was that it helped build infrastructure in schools that may not have ever been put into place. Again, we're in the education world, so we always have to talk their language. We still have to, fight and highlight and advocate for our nurses and what they're doing every day to support learning and academic achievement. But I think that certainly gave us a jump start in Massachusetts. I feel like, especially when we have an opportunity to have conversations with nurses across the country as nursing director, which is the position I am in right now, representing Massachusetts. And there are some amazing school nurses across the country, but they just don't have the support that we have in Massachusetts. And I always have said, I believe that we truly are the gold standard for school health services. And our children benefit. What could we do better? Obviously, and I think MSNO has taken certainly a front seat in trying to make that happen. And again, having become a school nurse in the late '90s, things. The paper records, so many things, evolved and changed after that. So looking back, it's a completely different animal than it was that many years ago. But it's good. It's definitely grown. The profession has grown, and hoping to attract more and more younger, newer blood into school nursing, I think will be important. And, so again, nurses need to understand what a privilege it is to really be a school nurse and have the opportunity to impact so many children's lives in the school setting.
Who wants to go next? Well, one thing that I've learned is that the nature of school nursing has changed over time in terms of the acuity of medical problems that the children have, that they need assistance with from a nurse, and also the medication administration programs and all of these other things that have happened. It didn't exist, at least when I was a kid. Well, that's a long time ago now, but could someone talk about their experience and coming into school nursing? What surprised you that you didn't expect when you were, from your previous experience in nursing, whatever it was?
I can start. So I think what's most surprising for new school nurses, and having had quite a few in the past few years start in our district, is the case management, specifically of those medically complex kids, and how much time and energy our school nurses are putting into making sure that they can come to school every day healthy and ready to learn. The partnership with teachers and specialized instructional support personnel within the school, and parents and families and outside providers, it's a heavy load, while also seeing all the other things that come through your office. I think when we think about school nursing, we're thinking about providing equity to our students, and especially to our most vulnerable students. And that's something that we see, at least in my district, all the time. The kids that we're talking about the most are the kids that need us the most. And they're the ones that we spend the most time with coordinating their care. And it's not something, school nursing isn't something that they talk about in nursing school. And they definitely don't teach you the case management skills required in nursing school to be able to handle it so autonomously with very little resources. So I think for me, I don't think it's a surprise I wasn't in nursing school that long ago. And not that long ago, they weren't teaching about school nursing. So when I came in, it is a learning curve. It is not suction and oxygen on the wall and you're calling a code. It is a lot different than what you're doing in those nursing school clinicals. And it's I think it's a shock to most people how much of the coordination and management we are responsible for that is behind the scenes that maybe nobody else knows, or maybe just the student and their parent knows. But I think it's important, and I think the people that need to know appreciate it. I don't think enough people share their appreciation for it, but we're definitely a group of nurses that understand each other, because nobody else quite gets it until you're in that role.
So once again, Florence Nightingale was right about the autonomous nurse.
Oh, very much so.
Once
yeah.
again, Meg.
I just want to add, I think what I remember experiencing, and what I've heard some new nurses and that I know talk about is, the number of kids who come in to the nurse's office, and it's not an injury, it's not an illness, but the child is coming with a complaint that could be mistaken, for an illness or an injury, and the nurse is spending a lot of time assessing sort of the emotional mental health status of the student, and then trying to work within the school. And especially in rural areas, there are not a lot of providers. There are very few pediatric providers. There are wait times for kids to get into just an intake assessment procedure of 6 to 9 months. And so those kids are spending time in the school nurse's office, and are only, I think I can think of kids that I know were only in school because the school nurse was there to support them and to check in with them and make sure they, had the downtime, the breaks they needed to be able to then go back to class. And the other thing I know, I experienced this, and in hindsight, I don't know why it was a surprise. And I know a new nurse in my district had the same experience. Kids are hungry. Kids come to school without breakfast. Now, of course, there are there's breakfast programs in schools since the pandemic, but I'm in a lot of rural districts. There are no school breakfast programs. There's no way for kids to come to school early. So there's that's a whole other level of care that's given.
And I just want to follow up with what Meg said. There was a time when children who had medically complex problems or who were different just didn't go to school, and they were kept home, or they were sent to specialized programs, and they were not in their community. And that was a huge disservice to those children. Luckily, a lot of those facilities have closed over time, and now the children in the community, they come to school, and their peers can see kids in wheelchairs and who have disabilities and G-tubes and trachs. And it's a wonderful thing that we have these children in school, but they need support, they need help, and the families need help to keep them there. And these are kind of I called them the big saves and the little saves. There are dramatic saves where you're giving an EpiPen and you're saving a life, but sometimes the save is just a smiling face, that you're happy to see a child. We in Waltham High School used to have a girl who'd come almost every day to see us and just check in with the school nurse. She had a very deprived background. She had a very, very harsh and difficult home life. And after she graduated, she got in touch with me through Facebook, and she said, there were many days I thought I'd just end it all and just not be there anymore because it was so hard. And she said it was the school nurses that kept me going because I knew you were happy to see me. There was somebody who cared. So I think that that's another way that school nurses help, and teachers do too. There are many school professionals that do, but it's the big saves and the little saves. They all count.
So Sharon, this must be especially true at your school.
Yes, that's what I was going to chime in and say, that my school is set up very differently. The children don't come to us. Nursing goes to them into the classroom and gives them their G-tube feedings, gives them whatever treatments that they really need. Things have changed a little bit about doing aerosols because of COVID, that we had to address. But I'd like to say that, we're in a temporary building, right, a temporary facility right now, sharing a school with a middle school, the Frederick, which is a middle school itself, and the Carter. So we're together, and it's so nice to be with other children who are middle school. So that's a little different for our children. But when we leave in 2 years, we're having a new school being built. Our program will be going from preschool to 22. And so we'll be going from 27 students to 65. So the other thing that I wanted to say is, when I first became a nurse with Boston Public Schools, they were increasing their numbers of nursing. Nurses had 4 and 5 schools at one point. And when I came on in the early or the late 1990s, they increased by 53 nurses. Okay. And there was a little hiccup in the whole process that we lost our jobs for a time. But I want to say that today, as of now, Boston has a nurse in every school. So you can see the difference. And a nurse is needed in every school, because the children are just whether it be mental health issues, whether it be diabetics in the school. We nurses are what we perform, how we do our job is geared by the students that are attending the school. And there's no lack of being able to find something to do, believe me, in today's environment.
Yeah, Dorothy, you went from public health nursing in the community to school nursing. What kind of school environments did you work in?
Let's see. I started out in a high school, and that was very nice. I enjoyed that, and it was similar to what I did at Boston University. I worked in their infirmary, but the difference was at Boston University, we treated the children, the young adults. And we had standing orders where we could give antibiotics and that kind of thing. So I started out in the high school. Then I worked in elementary schools for 4 years, and then I worked in a high school, a middle school, for 16 years. That was grades 6, 7, and 8. And at times when I had the middle school, I also had between 2 and 3 elementary schools too. So the amount of work was overwhelming, really was.
You were on the road a good part of the day.
What was that?
You were on the road during.
Oh yeah, well, yeah, it was such that also what happened was that we had very poor coverage for if we were out sick. And frequently we had to, besides our own schools, we had to cover someone else's assignment. And we'd be called over to another school, and then we would be missing giving our own kids some a medication that they would do. Yeah, so it was a very busy job.
Challenging. It
Yeah.
sounds like though you liked the middle school the best.
Yes, I did. Yeah, Yeah.
Yeah.
Yes, I did. The kids, they made me laugh. They were so funny. I enjoyed them a lot.
So what are the big challenges now that you face? And again, in a few minutes, we'll get to the pandemic, but outside of that pandemic experience, what's the biggest concern you have in terms of school nursing?
I want to pick up a piece that Dorothy mentioned, which was the coverage and having per diem nurses if the building-based nurse is out. And I think I know that's a huge challenge in the western part of the state. There are very few per diem nurses. And as Sharon mentioned before, we're in a nursing shortage again. And so it can be very stressful. If nurses have, things that they need to take care of and they don't have the ability to take a day off, they're not always able to do professional development. And I can remember just saying when I was first in school nursing that I could not get sick, and I didn't for years. And part of me thinks it was because I couldn't, because there was nobody to cover the office. And there were students that, if there wasn't a nurse in the building, the students wouldn't have been able to be there. So that's definitely an ongoing challenge, I think unrelated to the pandemic. And then the other piece in some areas as well is that there's a lot of schools that don't have an administrative nurse, like they don't have a nurse leader or a district nurse. And so, and sometimes there's nurses who are completely on their own. They're the only nurse in a small school district. And I think that presents additional challenges for them especially if it's a new nurse, until they build relationships with other nurses, until they connect with their regional consultants, and then start to get some of the additional support that they need. And in some cases, they have a strong supportive administration. Sometimes they don't, and that can be particularly challenging as well.
Yeah, I was just out for the 200th anniversary of Monroe, Massachusetts, and it just made me realize some of these towns is probably the only nurse in the town, let alone the only nurse in the school.
And,
True.
I was going to say too, I think some of the challenges around getting coverage, per diem coverage in the health offices is it's a pay issue, and schools, because they don't pay their substitute teachers very much, and so they don't anticipate needing to have to pay a substitute nurse. Although it's completely different. It's completely different. You cannot compare the qualifications of a substitute teacher with the qualifications of what a nurse would have to come in to a school setting, especially maybe not necessarily knowing all the kids, having to get familiar with the technology. Those are the big challenges, I think, the electronic health record. And so a lot of nurses, if they have an extra day, they may want to, work at the hospital again because they can make a lot more money. So that's a problem. I think that's probably a problem across the entire state, maybe. And, that's definitely an issue. So I think we all face that. And I think, again, schools that don't have a nurse leader or a nursing administrator at the helm to support them and advocate for them, that's also has to be a huge challenge in a school district. So the nurses need that. They need somebody to, be a voice for them at the table. And that's a critical piece.
I want to say one thing I do appreciate about Boston Public Schools is that they are big advocates for my school. It is true that if nursing wasn't there, and there's two of us that are full-time nurses, and then we have additionally one-to-one nurses and one-to-one paras. But if we weren't there, it becomes very awkward, unsafe, really unsafe, because again, they're nonverbal. I've done some creative stuff over the summer. It was just myself working. And so I ended up putting pictures on everything so that when somebody came in to sub with me, okay, that wasn't me being, them being by themselves. They would know how to take care of the kids. And I would put things down like a, like you would a cooking guide, you know, of what happens with each kid. So it is very challenging. And I can honestly say, I feel very blessed to really know that my service is needed, you know, and it's appreciated too.
I just want to remind people, if you have any questions or comments, we're going to have sort of an open discussion soon. Put them in the Q&A box and we can bring them up. The other thing, well, let's get to the pandemic, because people expect us to get to the pandemic. And the pandemic had a huge impact on everything, and not least schools, and not least the health in schools. And certainly a lot of issues came up to continue, related to continuing the educational enterprise in a safe fashion. And the nurses, I think, were key to that. Maybe not from the beginning, but and the school nurses stepped up and did a lot of things outside of their normal activities. So tell us about what it was like for you.
Can I start? Okay.
Whoever unmutes first.
Okay. Well, Boston, I'm really very proud of our nurses, all of them, when it comes to the pandemic. We spoke up through our union, saying, you know, what we thought we needed. We needed to be at the table. We needed a chair to be heard on what our needs are for our students. And with Boston, every school is different. Okay, so I can't speak for another nurse. They have to speak for themselves. They know that their air quality, they know the infrastructure of the school. They know their students to be able to speak up. And it was a great time of us coming together and advocating for ourselves in our schools of what our needs were. It was powerful going in to City Hall and having a sit-in and having a discussion, and the teachers came alongside of us. It was a very emotional time. And the Carter School is one of the schools that came back first. So in October, we were back in school with our students, those that wanted to come.
Carolyn, you're unmuted. I don't know if you want to go next.
I can't, unless you want to go, I can go after you. If you want to have something, go ahead.
I was going to say that the things that stand out for me in terms of the pandemic is, you know, certainly nurses took on many different roles. In the western part of the state, collaboration with local boards of health and public health nurses was more challenging than in some larger communities, because we didn't have just one local health authority to interact with. You know, we could have 30 public health nurses or boards that we were interacting with. And some collaborative relationships grew out of the pandemic. There's a group of public health nurses and school nurses in Franklin County that started meeting in the spring of 2020 and continue to meet on a regular basis to keep those relationships strong. As new faces come in, then they know who the nurse is in the various buildings or who the public health nurse is in an area. And that was really critical for the response, especially in the first year. There just was a lot of collaboration in terms of contact tracing and follow-up. The school district that I am housed in, we actually opened in September of 2020. We closed early for a couple of vacations and came back late, I think one winter break, but we had kids back in the building in the first or second week of September. And it was challenging. And it took an enormous amount of work on the part of the school nurses in each building and the whole team. So.
Yeah, I think definitely it was, as you have both said, a very emotional time. I felt like my nurses became emotionally fragile at times when they were inundated with large numbers of tests, especially when we were doing testing, and the health office really became a public health clinic. It really, all of the great things and outside the box activities and the normal things that we always did and needed to do to support the kids, we couldn't do anymore. So that was really frustrating. So trying to try to support my nursing staff. I have 19 nurses, so trying to support them through all this was, a little challenging, because I think of all of my 24 years doing this, this was sort of like the straw that broke the camel's back. I mean, and as Dorothy referenced earlier, infectious disease was really the reason why nurses went into schools. And in the beginning, way back in the day. And so, when we talked to school committee, we talked about the flu pandemic back in the early 1900s, and how schools did close then. Although some schools in the cities were actually safer places for the kids to be than in the homes, due to all kinds of, issues in tenement housing and whatever. So a lot of the same, and I found a report of a school nurse that was in Plymouth, where I am now. Back in the day, she reported the numbers of cases that were coming through. There was a death of the teacher. She worked closely with, the school doctor at the time. And I think that, if anything that the pandemic did that may have been a good thing, was the fact that it certainly, if anything, highlighted the role of the school nurse, it was the pandemic. And so, and again, working so closely, I feel like I was, talking to my superintendent probably a little bit every hour of every day, evenings, weekends. And then like now we don't do that as much anymore. So it's a little, you lose a little bit. I think that the collaboration piece within the district, within the community, with public health, everybody rose to the occasion and stepped up to the plate. And so I think that was really a gratifying thing. And looking back, I'm certainly more than happy it's over for now, at least. So, again, it was a very emotional time. And I actually did lose a nurse because she just did not want to come back after that year. So that was tough. I don't know if anybody else had that happen to them in the districts.
I think something else that happened, at least within our community, is that the perception of the role and the scope of the school nurse shifted. And we're still having a really hard time shifting it back in this kind of, not that we're seeing less numbers, but everybody's ideal of a post-pandemic society that we're living in. People are forgetting that we're not just a testing clinic. We're not just, the Grim Reaper that's walking down the hall to tell you your kid has COVID and they have to go home, which is what we have been for the past 2 years. And we are still dealing with administrators and school staff who are so COVID focused. They don't understand our role in prioritizing what we know is our scope and what our responsibilities are. And I think at least in our district, we're finding a hard time managing that balance. We're keeping, the professional lines of communication open and appreciating that there's still COVID, but also getting back to our purpose outside of infection control. And I don't know about anybody else, but our offices are busier this year than they were last year. We have seen hundreds of more visits that are not COVID related this September than we did last September. So although everybody thinks the pandemic is over until, they test positive next week and then it's back in their face, we have not slowed down. We're seeing so much mental health coming into our offices that has shifted the scope of a lot of our nurses and pushed those buttons and have forced us to, communicate with other school staff members who after last year, they think we're just the easy go home dismissal people. Unfortunately, when, as we know, school nurses were brought in to keep kids in school, not send them out. So that's something that I hope we're working on in Medford, is to try to shift that focus back to school nurses being able to keep kids in school and not just dismissing them.
Yeah, we hear a lot about the impact of lack of socialization among the kids because they're out of school, and there's some things are going to, it seems to me there's things are going to change, whether for the good or for the worse, because of the pandemic. And from a school nurse perspective, what kinds of things you think will never go back again to the way they were? Certainly we'll be zooming a lot more into the future, but where do you see things going? What is the post-pandemic, if there is such a thing, the post-pandemic era going to be like?
Well, in some sense, it's a little refreshing because we get to see all of the kids back. That isolation is no longer part of their lives, and the socialization that you referenced as well. Will things ever be the same? No, I don't think anything like that can ever happen. That impacts people personally and professionally over such a long period of time. It's almost like, I feel like my nurses have their guard up all the time, and they did have some contentious conversations with families who, were missing time at work because they were having to come and get their kids. Their kids were home. Individual kids were getting COVID like as soon as the other one got better. So some parents had kids home for weeks and weeks and weeks. And it was a very stressful time for everybody. And I think that it's almost like a PTSD. And so I think, and especially I can't imagine, I know nurses that work with children who are nonverbal or with major severe medical conditions that need, some expert skilled care. That had to be even more difficult. So I can't, I think, again, dealing with people's fears and trying to, not falsely reassure them, but reassure them that, we're doing all that we can to keep everybody safe and healthy in the classroom setting. But there are some teachers that, that still, again, the PTSD, like they have the fear if somebody has COVID in the classroom, it's just, it's still not back to normal. And it really may never be for some people, as many as others want it to be, and try to focus on the positives. But I think we're all, the kids are back. That's important. They're getting to, and some of the good changes, kids are doing some outside learning. We are getting back to some in-person meetings, which I'll never complain about again, because I think we all were a little zoomed out. But so yeah, I think it's just changed the culture of school overall. Again, maintaining the culture of health, but it's changed the culture of how things operate and what the expectations of the nurse are, for sure.
So there's something you said that makes me want to ask about, do you or the nurses you work with have experiences that made you uncomfortable in terms of dealing with the community or the parents, or your traumatic experience in this situation?
I think, go ahead, Sharon.
I have to say that, it became so intense, that's how I look at it. And I also had my mother who was sick and ended up dying in the midst of this, not from COVID though. It was a very intense time that it just seemed like from the beginning of the day, it was you were all absorbed in COVID and the Zooms that went on. I mean, the Zooms are still going on that I don't think that'll ever change now, because it's that, and I'm going to use it for Boston anyway. It's our really only way of being able to get so many of us together at one time easily. But it's draining, when you work all day and then you've got to go on for Zooms for PDs and such like that. But it's had everyone, I think, stop and think about their own mental health. Not just if I'm going through this, what is my students going through? And I mean, even people don't think that children who have special needs are nonverbal but they were so depressed. I mean, really, and despondent in a lot, so it's been very, it's been a life-changing event for everyone, truly.
I think some of our nurses had the most difficult parent interactions and conversations throughout the pandemic. We have had nurses called racist for, sending certain kids out of the classroom because of close contacts. Been told we don't know what we're talking about and there's no way we can be medical professionals because COVID's not real. Being told we're putting our students in danger for advocating for the vaccine and vaccinating kids in school-based clinics. And I mean, the Facebook posts that have been about our nursing staff over the pandemic from a small group, but a loud group of parents, it's really discouraging. And I tell my team all the time, I don't know why they keep showing up every day, but I'm forever thankful for it, because the amount of stress that they were under just to perform their job, and then to be met with resistance when all they were trying was their hardest and to do what was best for kids and families and staff. It's really difficult. And it's still something when we call parents for a COVID-related, conversation, I think we all take a deep breath before we dial that number, because we don't know what's going to meet us on the other end. And I don't know when that will change, just because we've all experienced a little bit of that hostility.
We have about a little less than 10 minutes left, so if people have questions or comments, put them in the Q&A, and we'll handle them that way. And so what do you think? If you had one wish for school nursing to address something that you want to see addressed, what would that wish be?
I'd say that all school nurses be supported by their district administration, by the state that they live in, by acknowledging the complexities of their role. And, I think that school nursing needs a little bit more acknowledgement for all that they do. That's one big thing. I think that what I would like to see moving forward, more funding, whether we, try to look at, alternative sources of funding, school-based Medicaid reimbursement, schools reaching out and applying for more grants. A lot of school districts didn't want to get into reapplying for this last grant with the Department of Public Health for a variety of reasons. And I think that that certainly negatively impacts the school health service program. So from my vantage point, I would like to just see, looking at how we can fund schools, and I go, Western Mass may not be the same as Southeastern Mass, and like you'd like to see some equity across the board. Again, because this is to support the future of the Commonwealth. These are our kids, and that's what it's about. And the school nurses are a conduit and making that happen. So.
Yeah, Carolyn, I was going to say, staffing and respect and salary, so that school nurses are treated as professional nurses. We talked before about per diem salary, being comparable to like the teacher, a substitute teacher, and it's just not the same. And I know in a lot of places, school nurses are on the same contract as a teacher, and yet the requirements of the position is it's different. I don't want to say it's different, but I think when you look at nursing in other settings, I'd love to see school nurses be compensated. And I want to see the collaborations grow, and I want to see the creativity to address the issues of equity and access. I, for one, would love to see telehealth in rural school districts, throughout the Commonwealth. You know, just to, again, it's that access piece. And especially where you have families that may not be able to get the kids during the school day to get them to an appointment. And then I want to go to something Avery said early in the conversation about student nurses and looking to increase awareness, exposure for school nurses, student nurses to school nursing, so that early in their careers they have more familiarity with what school nursing is all about, and the amazing opportunities that they can find in the school setting.
I would like to see school nurses continue to advocate for students and for student health, and to continue to grow community collaborations. We had a school health advisory committee that eventually they, evolved or devolved into wellness committees. But at that committee, we had our state rep from Waltham, we had city councilors, we had police, we had EMS, we emergency services. We had a really broad-based community collaboration. Newton Wellesley Hospital was very active, and those committees need to be sponsored in every single school district and meet regularly, because those relationships are key to for people to understand school nursing, but for school nurses to understand what's going on in the community too.
Dorothy?
Yeah, I'd like to see school nurses communicate more about what they do. I'd like to see them write more and let their voices be heard. And also I'd like to see, like, the national board, the NASN, sponsor some classes for nurses on writing, to like how to do it, and give them some tools to do this.
Good.
There's a question about, how do you encourage nursing graduates to go into school nursing when, they could work 3 12-hour med-surg shifts in the hospital and make more money and have more time for family or other things, and how do you encourage them to work, and work in an environment where they have all these other people there and work autonomously in the community? And I think I know the answer, and that is the way you eloquently speak about school nursing.
I want to say that I think that as a new graduate, I do think, I know, honestly, I believe that you really need to be in the hospital or really supported before you come into school nursing, where you have this autonomy. You have to work into it. You can't just jump into it. That's my belief. I'm also an educator, and I want to say that I do share what I do with my students, and they're very excited about school nursing. Oh, I thought about that. I'm quite amazed. I also opened up the door before the pandemic anyway, where I would share with my students and say, please come by, see what I do. And they would take me up on it. And we do have a clinicals where Northeastern right now comes into our school and does has their students come in and take care of our students as nursing students. I'd like to see that more when we go into our new school with 65 students. But I really can't get over the idea that one thing I would love to see better is, you know, people claim to be, or organizations claim to be stakeholders in education and in nursing. And they're good at telling us what to do, but they're not very good necessarily in sitting down and working out that complexity of everything. I mean, just getting a fax from a doctor sometimes is such an arduous thing. I'm like, I don't get it. We have a fax number, you have a fax. Why can't we get these orders? But it is a problem. And so really looking at those barriers of all of it, of us working together would really be very nice.
Unfortunately, our time is up, and I want to thank you for sharing your experience and perspective this evening, as well as for all the things you do and have done in school nursing. And I think, as I said, this will be posted. I'm sorry, there are some questions, unfortunately, came in late and comments, but this will be shared on the Public Health Museum website. And thank you all very much. And if the panel could stay on for a few minutes, and our audience, the program is over, and thank you all for attending. And if you do have questions you want to send in, I'd be happy to hear about those. You can send them to info@publichealthmuseum.org, and we'll channel them, share them with the panel. Thank you and good night.